Ever wondered what artery helps you to recognize face, to see a beautiful sunset, to create memories and awareness? Hi, it's Dr. Kenny and welcome back to Neurosketch with Dr. Kenny. And today we are examining how this artery maps its territory, and let's go. Posterior cerebral artery. Posterior cerebral artery is the topic of discussion today. The posterior cerebral artery is the topic of discussion today. So the posterior cerebral artery, as we have seen, it is traditionally originating from the basilar artery at the terminal branch of the basilar artery. So the basilar artery will terminate by forming two terminal branches, and that will be the right posterior cerebral artery and the left posterior cerebral artery. So that is and it contributes to the cycle of Willis, the cycle that gives opportunity to the collateral blood flow in case of blockage of the blood vessels. And so it's safe to say that the basilar artery, the posterior cerebral artery was the terminal branch of the basilar artery. That's traditional thinking. But what if I tell you today that the basilar artery contributes only to 70% of times origin of the posterior cerebral artery? This is to say that in a population, only 70% of people will have the posterior cerebral artery originating from the basilar artery. What does it mean? Very crazy, right? Because 20% of the population have the posterior cerebral artery originating from the posterior communicating artery, on either side. Very crazy, eh? Well, it is a little bit strange, but if you go into embryology of the the origin of this vessel, we will know that the posterior cerebral artery will come from the anterior cerebral artery, but that's a bit of embryology. But don't worry about it, because 70% of time the posterior cerebral artery comes from the basilar artery. So that's traditional thinking. But we have 20% of population that have the posterior cerebral artery originating from the posterior communicating artery, and we know that posterior communicating artery also said it is a branch of the internal carotid artery. Well, because if you take 70 plus 20 is 90. So what about the 10%? The remainder of 10%? Well, the remainder of 10% is a contribution from both, the contribution from the basilar artery and the posterior communicating artery. So this is to say that 10% of population will have the posterior cerebral artery originating from both posterior communicating artery and the basilar artery. So posterior communicating artery and the basilar artery, but seriously, like a greater percent of population have the posterior cerebral artery coming from the basilar artery, and that was traditional thinking. Well, so what are the branches of the posterior cerebral artery? So the branches of the posterior cerebral artery, first of all, the posterior cerebral artery will supply most of the posterior cranial fossa structures. So the structures of the posterior cranial fossas must be supplied by the posterior cerebral artery. So the posterior cerebral artery also can be divided into four parts, but maybe we will not talk about the parts of the posterior cerebral artery. And so maybe we see the branches of the posterior cerebral artery. So the posterior cerebral artery will give the anterior temporal branch that you can trace the name, that it is a temporal branch but anterior. So it's an anterior branch of the anterior temporal branch of the posterior cerebral artery that will supply this downstairs of the temporal lobe, but on anterior surface. And then we have the posterior temporal branch of the posterior cerebral artery. So we supply also the posterior part of the temporal lobe, but inferior surface. I think you can see. Also, it has got a branch that is, a dorsal branch of the corpus callosum, and this branch will go to supply the splenium, the corpus callosum. Remember, we said the corpus callosum is communication between the two cerebral hemispheres. So we have the left, we have the right, and so it's a communication. And I will tell you today that the corpus callosum, at least the splenium of the corpus callosum, will help communication between the occipital area, the visual area, and some part of the language area. So if we have damaged the splenium of the corpus callosum, we have this connection between the occipital, between the visual area and the language area, and we know what it means, and I will tell you what it means to have this connection. Well, we'll have another branch that with the medial occipital artery, and the medial occipital artery will terminate by forming two terminal branches. That would be the parietal occipital branch. The parietal occipital branch will travel in parietal occipital sulcus. We walk in the parietal occipital sulcus, and we also have a calcaline branch, and the calcaline branch will walk in. They will travel in the calcaline fissure. And we remember that the calcaline fissure has got two banks: the upper bank, the superior bank of calcaline fissure, and the inferior bank of calcaline fissure. And we know how they are associated with in visual pathway. What part of the visual space that they, what part of the visual space are they representing? Well, so that's a bit of branches of the posterior cerebral artery, and let me complicate your life a little bit here. Okay, so it's more like the same as previous one, but we have added some stuffs here. Yeah, so this is the posterior this is the basilar artery, this one, and this one is the superior cerebral artery. The superior cerebral artery is not the branch of the posterior cerebral artery, it's the branch of the basilar artery. So the posterior cerebral artery now will give the branches that we have said. So it will give, now maybe we can say those branches we have seen in the previous picture here. These we can term them as the cortical branches. The branches that supply the cortex. So what are those branches? We have seen the anterior temporal branch. Now we saw the posterior temporal branch, and we saw also the medial occipital artery, and the parietal occipital and calcaline branches. Those we can term them as the cortical branches. But the posterior cerebral artery supplies more than the cortex. It supplies the deep structures within the brain. Having said so, it means that the posterior cerebral artery will give something like thalamo-geniculate arteries that will go to supply the thalamus and geniculate. Remember about the geniculate bodies, we have the lateral geniculate and the medial geniculate, and you know how they are associated, one with vision, another one with auditory information or auditory processing. You remember that. And so that was thalamo-geniculate, and it is a branch. These are the small branches of the posterior cerebral artery, small branches of the posterior cerebral artery. So it also gives another branch here, which is the posterior medial choroidal artery that goes to the choroidal plexus. The choroidal plexus, these are the choroidal plexus, these ones. So the choroidal plexus are the one that are associated with secretion of the cerebrospinal fluid. So production of the cerebrospinal fluid happens within the choroidal plexus that are within the lateral ventricles, left and right, and the third ventricle. They also participate in production of the cerebrospinal fluid. So they get their contribution from the posterior cerebral arteries, or the posterior cerebral artery. So we have the posterior lateral corridor artery. Remember, we had the anterior corridor artery. That was a branch of the internal carotid artery, where it will also supply part of the corridor plexus, and we also have contribution from the posterior cerebral artery through the posterior lateral corridor artery that will go to supply the cortical plexus as well. So I have divided these branches. I have divided these branches into the cortical branches that will supply the cortex, and the central branches that will supply the central structure, like the deep structures within the brain. So have your time you pass through the branches that I think they are easy to remember. And let's make a move. Well, now let's discuss about the territory of the posterior cerebral artery. So the posterior cerebral artery, we are now 100% sure about the anterior cerebral artery and the middle cerebral artery. And now let's discuss about the posterior cerebral artery. So we have seen some of the branches that are anterior temporal branch that will supply the lower surface of the temporal lobe. Okay, we have seen the caricalani branch that will supply this part. We have seen the parietal occipital, and we have seen something like those carousal branches, the posterior, something like posterior carousal branch that will supply this medial structure. And so these the temporal branch will now reflect. See now, they will supply the medial side, the inferior medial side, and then a bit of the lateral surface. So these are the terminal, you see like this, these are the small branches, the small terminal branches of those branches that will supply the inferior surface. So this is to say that the posterior cerebral artery will supply from this portion all the way to this portion on the medial side. And don't forget, it supplies the thalamus. Oh my god, I haven't mentioned about the midbrain. The midbrain is also supplied by the posterior cerebral artery. So this part here, the thalamus, the splenium of the corpus callosum, this part of the parietal lobe, this part of the occipital lobe, the whole of the occipital lobe is supplied by the posterior cerebral artery. This part of the temporal lobe on the inferior surface, this is how it looks like. All these parts are supplied by the posterior cerebral artery, and on the lateral surface it supplies this part here. This part, remember, this part was supplied by the middle cerebral artery. Well, so it supplies the inferior temporal gyrus and the wall of this one. So you cannot forget that the posterior cerebral artery will give branches that will supply the midbrain. The midbrain is part of the brainstem. The midbrain, it supplies the subthalamic nucleus. It supplies the thalamus, and the subthalamic nucleus, because we say the subthalamic is just below the thalamus. So the thalamus and the subthalamic nucleus, they all receive the blood from the posterior cerebral artery. And the temporal part of the temporal, parietal, and the occipital cortices we have already seen. Yeah. So let's take a closer look on the deep structures. Maybe this is just on the basal ganglia system. The basal ganglia system, but we have already seen how other deep structures are supplied. So this is the posterior cerebral artery. So this posterior cerebral artery will supply the thalamus and the part of the corpus callosum that is not seen. And remember, we have already seen the midbrain, how the midbrain, how they are supplied by the posterior cerebral artery. So this is that famous picture of ours that we've been using since the anterior cerebral. So remember, the anterior cerebral will supply this part The middle cerebral will supply this part, and now the posterior cerebral now will supply this inferior portion over here. This is coronal section, remember. So it supply this portion here on the superficial, and it will supply this part in the deep. What is this part? This part is thalamus. So the thalamus and subthalamus somewhere here will all receive the innervation, the blood supply from the posterior cerebral artery. So this is coronal section. What about the horizontal section? Well, on the horizontal section now you can appreciate that the posterior cerebral artery will supply this narrow strip somewhere around here, and remember we said the bigger part was supplied by the middle cerebral artery, and that was the basis, or that was the reason for why most of the stroke will affect the middle cerebral artery, because it traditionally supplies the bigger part of the cerebral hemisphere. And so most of time the stroke will involve the middle cerebral artery. And remember, the middle cerebral artery will represent the face and arms more than the lower limbs. So the presentation of stroke is commonly face and arms, because the most involved part is the middle cerebral artery, and the middle cerebral artery the biggest. That was previous discussion. So the posterior cerebral artery will supply this part over here, this part which is the occipital lobe and occipital cortex. And remember, at the occipital cortex you see we have the primary visual area, so it will supply the thalamus, and we also have parts of the corpus callosum here. This is the corpus callosum, so the splenium of the corpus callosum. And you can now appreciate that this corpus callosum will communicate between this part and this part. And remember we say this kind of commissural tracts, and it also communicates between the visual area and the language processing centers and the language areas within the brain. So if you have this connection, if you have like something like stroke here at the posterior cerebral artery involving the corpus callosum, means we have disconnected this part for the rest of the language processing center. So what does it mean? Will you be able to see if we have exclusively damaged this part and this one is spared? Yes, you'll be able to see. Will you be able to read? No, you'll not be able to read. You cannot see, but you cannot read, and that's what we call alexia. I will emphasize it shortly. So let's discuss about the clinical correlates of the posterior cerebral artery. What is the clinical picture of someone with a stroke on the posterior cerebral artery? What are the territories that will be affected? Number one, you cannot forget, we have said that the posterior cerebral artery will give branches to the occipital lobe, the occipital cortex, and we know how occipital cortex is important in vision. So if someone has got damage on the part that affects the occipital lobe, will present with visual problems, namely the most common is hemianopsia. And I think now you can tell why we have a hemianopsia. Will it be unilateral or bilateral? You have to remember, because we discussed it in the visual pathway. We used like 4 videos preparing and discussing the visual pathway. So the summary is, we say anything that occurs behind the optic chiasm will have presentation on both eyes, and we have the presentation on both eyes. And remember about retinotopic organization, we said anything that damages the most posterior portion of the visual cortex will have affecting the central part of the visual space, the macula of the visual space. So anything that spares the posterior portion will have the so-called the macula sparing region. So the region will spare the central part of the visual space, the central part, the macula sparing. That we discussed about all of this. But we can have cortical blindness, like total blindness, if we have like bilateral damage, bilateral stroke of the posterior cerebral artery. So the posterior cerebral artery of the left side and the right side got blocked. We have cortical blindness. Like your eyes are perfect. They haven't got no problem, but your brain cannot see. And remember we said what sees between the eyes and the brain. Now it makes sense to you. If you have like cortical damage or something on posterior coronary fossa on the occipital lobe, you have cortical blindness, total blindness, and something like TB, tuberculosis can also cause the cortical blindness, like your eyes are perfect but your brain does not see. So that was a bit of the occipital cortex. And remember, we have said the posterior cerebral artery will also supply the thalamus. We supply the thalamus. And the thalamus is like the grand, I don't know how to make it plausible to you. Thalamus is very, very important concerning almost everything in the brain. Almost everything, like the sensory, the motor, the speech, and almost everything. So if you have damage with the thalamus, well, you can have the contralateral sensory loss, like you lose sensation of the contralateral side of the brain, of the body. We can have thalamic aphasia. Well, it is very difficult to emphasize that at this point, because at this point, we have Broca's aphasia and Wenger's aphasia, but we can have more than that. And just to make it making sense to you, just think that the thalamus has got connection with language processing centers. So if you have damage with the thalamus, it can result into aphasia, and that aphasia we call it the thalamic aphasia. Well, about the subthalamic nucleus, we have something like hemiparrhythmas. Sorry, that was meant for hemiparrhythmas. Oh, that's confusion. That is confusion. Let me change it. Yeah, that way. So damage to the cut in the blood supply to the subthalamic nucleus will result into conditions like hemiparrhythmas. But the midbrain, remember we said the midbrain is also supplied by the posterior cerebral artery. So the damage to the midbrain, remember the midbrain, number one, it has got the nucleus for oculomotor nerve. So damage the midbrain, we can have oculomotor palsy, the paralysis of the oculomotor nerve. And what is the presentation of the oculomotor palsy? Well, the eye, first of all, we have the dropping of the upper lid. The upper eyelid will dropping of the upper lid. The eye will like be dropping and pointing outward. So dropping and out, down and out eyeball. And that's a typical presentation of oculomotor path. Well, we'll have a separate discussion on oculomotor palsy, and don't forget to subscribe and stay tuned because I drop it soon. And another presentation, remember in the midbrain we have the cortical, we have the cerebral peduncles. Then cerebral peduncles, they will take the cortical spinal tracts, and the cortical spinal tracts are important for motor. So we will have the contralateral. So this is not contralateral. I'm sorry. This should be the contralateral hemiparalysis. Let me change. Sorry. Yeah. So contralateral hemiparalysis. So paralysis because we have the cortical spinal tracts are affected and they travel within the cerebral peduncle. Well, what about the temporal lobe? The temporal lobe will have the memory loss. So memory loss for the temporal lobe. And what about the splenium, the corpus callosum? We have said the corpus callosum will connect, the visual processing centers with the visual cortex and the language processing center for you to be able to read what is written. Because while you're reading, you are involving your cortical, you are involving your occipital cortex to read, to see. For you to be able to see, you are involving the occipital lobe, but you are involving your language center to be able to read, because not everything that you see you can read. For example, you cannot read Chinese, something written in Chinese or something written in German or something, a form of different language you cannot read. So you can see it, but you cannot read. So for you to be able to see, for you to be able to read, you need your occipital lobe. You need your occipital, the visual area, to be connected to the language area for you to be able to see. So if we have damage to the splenium of the corpus callosum, we are disconnecting this part, the visual centers, the visual areas, and the language areas. So you can be able to see, but you cannot read, and that's what we call alexia. Alexia is inability to read. You can also, it's very strange because you can also you can't also read your own writing. So you can write maybe agraphia. Let me make it clear. Agraphia is inability to write. That's agraphia. But if we have damage to the spinum of the corpus callosum, we have alexia without agraphia. Means we cannot read but we can write. So it's very strange because you can write but you cannot read even your own writing. You've just written something but you cannot read it back. That's alexia without agraphia. It is very strange. It is very, very strange. It is a very strange kind of clinical presentation and a kind of experience. So, in summary, the combination of hemisensory and hemianopsia without paralysis is visually diagnostic of the infarction or stroke in the posterior cerebral artery territory. Remember, the hallmark of the posterior cerebral artery infarction would be the occipital cortex. Hemianopsia is the hallmark. But also the alexia without agraphia is also a hallmark of the posterior cerebral artery. So that is it from today's discussion on the posterior cerebral artery. Soon I will upload a video on the watershed areas, and I think that will be able to go for clinical scenarios on the bright side of the brain. Ciao and see you next time.